Welcome to Success MRCP. Cardiology MCQs No. 4. A 58-years-old pharmaceutical worker who is a somewhat overweight develops erectile dysfunction over the period since his last birthday. There is no history of any other medical complaints. He goes to his physician and asks him to do some medical investigations. Which of the following are the most relevant tests to be done at the moment? 1. Complete blood counts only. 2. Testosterone, HbA1c and lipid profile. 3. Investigation for prolactinoma. 4. Liver function tests. 5. Renal function tests. Answer: 2. Update. Testosterone levels in men versus women. Normal testosterone levels are usually described as of 300, 1000 ng/dL for men. 15, 70 ng/dL for women. Men typically produce the most testosterone during their teenage years. For adults, healthcare providers use the following HbA1c target ranges. A normal A1c level is below 5.7%. Prediabetes is between 5.7 to 6.4%. Type 2 diabetes is above 6.5%. The goal for most adults with diabetes is an A1c that is less than 7%. HbA1c conversion chart. The HbA1c test measures how much hemoglobin in the blood has become bonded with glucose, illustrated as yellow glucose on red blood cells in the graphic above. This gives an indication of diabetes control over the previous 2 to 3 months. Since June 2011, the way HbA1c results are reported switched from a percentage to a measurement in moles/mole. To make sense of the new units and compare these with old units and vice versa, see the table below. Clinics and labs often give results in both measurements. Many of us still use the old percent measurements. Old unit equals percent HbA1c. New unit equals mole/mole. For example, a target of 6.5% is now 48 mole/mole. A HbA1c should always be used as information only, it is only part of the picture. However, the result will give an indication of how well your overall control is and let you see if there is room for improvement. Many things affect your HbA1c. And managing diabetes is looking at ways to manage those effects as quickly as possible to limit the length of time out of optimal range. Never ever beat yourself up, try and be positive and find one way to try and reduce it next time. There are always things that can be done and make a difference. A complete cholesterol test, also called a lipid panel or lipid profile, is a blood test that can measure the amount of cholesterol and triglycerides in your blood. A cholesterol test can help determine your risk of the buildup of fatty deposits in your arteries that can lead to narrowed or blocked arteries throughout your body. A cholesterol test is an important tool. High cholesterol levels often are a significant risk factor for coronary artery disease. It's interesting to note that the percent HbA1c measurement does not correlate exactly to average blood glucose test. Results on your blood glucose meter. This table shows the differences between HbA1c and average blood glucose. An example is if your old HbA1c was 7%, it would now be reported as 53 mole/mole, and this would be equal to an average blood glucose of